So on an admission screen, the referring vet and the clinic for the specific admission that you're setting up refers to the referring veterinarian who actually referred the patient to the hospital for this specific visit. Sometimes that's the primary veterinarian, and often that's the case, but sometimes it's not. Sometimes that would be regular vet sent the animal to a specialist, and the specialist actually referred the animal to your hospital or maybe an emergency clinic. So the way you can indicate whether or not this is simply the referring veterinarian for the episode or if this is the primary vet is this little icon here off to the right of the RDVM card and the clinic card. So as you'll see, the default is that they are uncolored, and basically that means that the icon's inactive. However, setting the patient or setting the RDVM as the primary RDVM is as simple as clicking on that little icon. So if I click on the icon here, I'm going to get a pop-up that says save the changes and make Patricia Dragon the patient's primary DVM. So if this is the primary vet that cares for the animal, you're going to click OK. And when you set the primary vet, you'll see that now the icon is colored in, which means it's active. And the same is true of the clinic. So some patients have a primary clinic, but they see all the doctors at the clinic, and so you may only want to put the primary referring clinic in the system. And in other instances, and you may want to identify the RDVM each time they come in, versus some animals are seen by the same vet every time they go into a clinic, and so you might want to set a primary vet and clinic as well. All right, so that's the differences between a primary vet and that referred the patient in as opposed to a veterinarian that referred the patient in that's not the primary vet on the case.